Okay, welcome student to pharmacy lecture note. Today we're going to discuss about the adrenal gland in the series of lectures of endocrine system. We will discuss about the various hormones that are secreted from the adrenal glands in this section. Now let's see first of all the anatomical position of the gland, that is the adrenal gland. For a better understanding, we do have a drawn picture on the whiteboard. You can see this is the kidney. We do have a pair of kidney, and if you do find the kidney to the anterior superficial part or the superior part of this kidney, you do have a tissue portion which is known as the adrenal gland. And these adrenal gland, as the endocrine hormones are being secreted, so obviously this gland has to be highly vascularized. Now if you see the anatomy of this structure, you will find that as the radial vein and the radial artery supplied to the kidney, so you will find that the radial adrenal artery and the left adrenal vein do have a supply to this gland which is highly vascularized. Now let's think, we have to discuss that how the adrenal glands actually involved in the secretions. What are the regulator factors which influence the release of the various hormones from these glands? For this, let's have the pathway to understood. Now this is your frame, this is your brain, which do contain the hypothalamus and the pituitary portion, isn't it? The hypothalamus and the pituitary portion. You must be knowing that from the hypothalamus there is a regulator hormone or the regulator product which is released, which do control the release of the hormone from the specialized hormone from the anterior pituitary. Here you will find the corticotrope is the specialized cells involved in the anterior pituitary for the release of the hormone which will be involved in regulating the secretions of the hormone from the adrenal cortex to some extent. Now the hypothalamic product that is released from the hypothalamus is corticotropic releasing hormone. Now corticotropic releasing hormone will ends up on influencing the corticotropes via the hypophyseal portal system, and this is your anterior pituitary. Okay, now within the anterior pituitary or in this lobe, what we have the corticotrope. Now it will influence, as a result what will happen, we do have adrenocorticotropic hormone being released into the circulation, and this adrenocorticotropic hormone will bind with the gland cells for the release of hormone secretions. Now let's move to the gland view. This is the adrenal gland. Okay, this is the adrenal gland. If you see the transverse section of the gland, you will find that it has two area. The innermost area is known as the adrenal medulla. Okay, this is known as the adrenal medulla. To the outer area, majorly covered, is known as the adrenal cortex. Okay, this is the adrenal cortex. So for adrenal gland, what we have the innermost adrenal medulla, and we do have adrenal cortex. Now let's concentrate in adrenal cortex. If we have a section view of this particular adrenal cortex, then we will find that it do have a 3-layer zones. Okay, now see the section, we have 1, 2 and 3. Now if I consider this one, suppose this is the outer portion which do present the capsule, but is nothing but it is a capsule layer within the adrenal cortex. Now let's see, this layer is known as zona glomerulosa. Okay, the zona glomerulosa. So the outer layer, which is known as the zona glomerulosa. Okay, zona glomerulosa. Now the question is, which specific hormone is involved in the secretion here? The specific hormone is the mineralocorticoids. Okay, mineralocorticoids. One of the major mineralocorticoid you should remember, that is the aldosterone. What would be the purpose of this? Their purpose is to maintain Their purpose is to maintain what we can say, maintain the mineral homeostasis. Okay, mineral homeostasis. Now next what we have? Next we have the next zone, that is this one, the 2-1 here in between this. This is nothing but this is known as zona what? Fasciculator. Okay. This is zona fasciculator. What does it do? It involves in the secretions of which hormone? It is involved in the secretions of glucocorticoids. And what it does, this glucocorticoids is actually involved in affecting the glucose, okay, glucose homeostasis. Okay, glucose homeostasis. Now we left with only the innermost layer, that is this one, the 3, which is known as the zona reticularis. What does it call it? We call it zona reticularis. And zona reticularis, if we see, what we will find that just zona reticularis actually involved for the secretion. Zona reticularis, I don't have a space, so I am writing here zona reticularis. From there you will find that androgens, okay, the androgens are being secreted. Okay, the androgen. And what does it do? The androgens is actually showing the masculinizing effect, isn't it? So this we have about the adrenal cortex of adrenal glands, which involve in the secretions of mineralocorticoids, glucocorticoids and androgen for their specific functions. Mineralocorticoids for mineral homeostasis, glucocorticoids for, or rather affecting glucose homeostasis, and androgen do have a masculinizing effect. Thank you.